Hello, hello, hello. Thank you so much for tuning in. Today, we are going to be talking about a very sad but necessary topic, especially when it comes to women's health. Before we get started, trigger warning, we're going to be talking about miscarriages, abortion, a lot of sensitive topics around maternity. So, just wanted to provide that trigger warning. Adrian, it's so nice to have you on.
Yeah, it's great to be here. Unfortunate, sad context of why we are here and why we decided to have this live and have this discussion and about what's going on with women who are pregnant.
Especially with this upcoming election, it obviously we know where each party stands, and it's dangerous that the state that we are in, where healthcare is becoming political, where
Hmm.
healthcare should not be political. Um, Politicians don't go to medical school, or they don't go to nursing school or PA school, and they shouldn't be making laws and decisions about women or healthcare because situations like this can happen. So, Josely Barnica is one of at least two pregnant Texas women who died after doctors delayed emergency care. She told her husband that the medical team said it couldn't act until the fetal heartbeat stopped. So, Nurse Adrian, can you tell us more about what you found in regards to the laws in Texas and this heartbeat law?
Yeah, so a lot of people may not be aware that other states passed prior to 2022. There were other laws being passed around the country restricting reproductive freedoms for women and really creating extremely dangerous laws like this one, which ultimately this law resulted in this woman's demise, unfortunately. So the heartbeat, basically, it's called the Texas Heartbeat Bill, which was passed in 2021, and I believe just September 2021. So this, as long as there is a heartbeat, there can be no intervention, uh, like an ectopic pregnancy, for example, we were discussing prior to the show, could have a heartbeat, but it's not going to be a viable fetus, right? So, and these are medical emergencies that require some pretty urgent care. Um, but the Texas law is basically that it allows private individuals to sue anyone who performs or facilitates what's considered an illegal abortion. The minimum penalty is $10,000. And basically, a definition of unborn child is any stage of gestation. And there is an exception for medical emergencies, but because of the law and the way it's written and the threats being made to physicians and providers, it's basically, terrified providers. So there's a paralysis going on of intervention in emergencies like this lady experienced.
Exactly. So in this case, she was in Houston in a hospital bed, and the fetus was on the verge of coming out. Its head was pressed against her dilated cervix. She was 17 weeks pregnant, and a miscarriage was in progress, doctors noted in hospital records. So this was not going to be a viable pregnancy. The
Mhm.
fetus was not going to make it. At that point, they should have offered to speed up the delivery or empty her uterus to stave off a deadly infection.
Mhm.
More than a dozen medical experts told this publication. But when Barnica's husband rushed to her side from his job and relayed the information, they said they had to wait until there was no heartbeat. It would be a crime to give her an abortion. And that's essentially what Nurse Adrian was talking about, is because of how these laws are written, the threats, the ambiguity, healthcare providers are very hesitant. For fear of like ramifications or repercussions on their license and on being fined.
Mhm. Yeah, exactly. And this is, really, it's hard to imagine and where we stand in the United States with maternal mortality is is extremely high for a developed nation. Um, we're 2021, 32.9 deaths per 100,000 live births. And then the median is 7 deaths per 100,000. So we're ranking pretty poorly in the average there, worldwide in the numbers. And this is happening all over the country. And it's certainly happening to people who are unable to travel across state lines or into other countries even to seek some relief. But this is an emergency situation this woman was up against. This is not something that you could do in a week later or a month later or deal with. I mean, these are urgent medical emergencies. So we're basically saying in certain states or in this country, if you're a woman and you're in this category of medical emergencies, we're going to just let you die. We're not going to medically intervene. That's ridiculous. This woman, I believe, already had a child, right? She had one.
Yes, she already had one daughter. So for 40 hours, basically her uterus was open and exposed to bacteria. So she died 3 days later after she delivered. She died of sepsis. Um, she's one of at least two Texas women that have lost their lives after doctors have delayed care, so treating miscarriages, because this falls into a gray area under the state's strict abortion laws that prohibit doctors from ending the heartbeat of a fetus. And neither of these women had wanted an abortion, but that didn't matter. So this is again, this is like Adrian said, this is an emergency care that has not been provided for fear of repercussions.
Hmm. And I don't know if you had seen this, but I pulled this up. Johns Hopkins did a study on this particular Texas ban, and it was able to show that this, what is it called, Senate Bill 8, has resulted in an increase in maternal mortalities and infant deaths. So I mean, it's both. It's doing exactly the opposite of what it's meant to do. Um, I mean, here's a woman who will not ever have any more children. She's not alive.
She
Her
can't
child,
raise her
I
child
mean,
grows up motherless.
right. So this is not supporting a family, no matter what. So this was interesting that in the first 28 days, there was an estimated 145 excess deaths in the post policy period. So within 1 month post implementation, these results were not observed in other states at the same time. So this is significant that this law goes into effect. Boom, 145 women die in excess of whatever the averages had been for that time period in this research. So I don't know how we, how we move forward and how people can look at themselves in the mirror in Texas and in some of these states that support these laws. This is,
I think it's ignorance, frankly. It's lack. The world is not black and white, and
mhm,
they can't account, like in their mind they can't account for what is going on, or they can't account for these outlier situations.
yeah, yeah. This is really an unfortunate time period we're in. It's a very unsafe time period. And of course, women who are poor, who have lack of transportation, lack of access to healthcare, who may not be finding out till a later point in their progress of their pregnancy that they are having some complication. All of these things increase the risks as well for complications and mortality. And we know very clearly who this is affecting the most. It's disproportionately affecting poor women, women of color, women who are not able to just, fly out of the state the next day and go somewhere and get this handled. It's not
Mhm.
possible.
Yes. So, like, again, here's her autopsy report, and she died of sepsis. And I do want to point out that the term abortion in healthcare doesn't mean, it just means when a fetus is expelled, like whether it's naturally out of the body, or it doesn't always mean that this person had an abortion or underwent abortion, because I know that that's been a point of confusion sometimes for people. So this
Hmm.
was a spontaneous abortion.
Hmm.
Um,
I'm going to put in the comments the link to the article by Johns Hopkins so
mhm.
folks can have that, who are on the live and who want to look at this. Sorry, it's kind of a long link. Hopefully it works. But the article is called Infant Deaths After Texas 2021 Ban on Abortion in Early Pregnancy. And I'll copy that and put that in as well. So you can just Google that article name. And that is very informative about what's going on. This is something that, um, you know, the legislature and the people making laws in these states and in this country are going to, have on their consciousness. But when we have let me see. There were 1,913 observed maternal deaths in Texas from March to December 2022, right? Which is already very high. So Texas is a little bit higher. It's not the highest in the country, but they're already on the high end. Mississippi is one of the highest states for maternal deaths, but this is a 12.7 increase above the 1,697 infant deaths for this time period. So this is talking about infant deaths, right? Not maternal mortality. That would be, there's another study on that, I believe, as well. But again, there's unnecessary deaths happening because of lack of prenatal care. Again, this is such a complex, um, situation. It's difficult to fathom as providers and as nurses working in healthcare. Our job is to save lives, prevent suffering. This is part of our licensure. It's part of what we're expected to do. Yet in these situations, everybody in healthcare is paralyzed and we're unable to fulfill our obligation to patients to keep them safe. I mean, this could be anybody's daughter, Gesundheit, sister. Um, this was a mother already. So this is a very unfortunate situation.
And yeah, so it says in lawsuits, court petitions, news stories, dozens of women have said they faced dangers when they were denied abortion starting in 2021. One suffered sepsis like Barnica, but survived after 3 days in intensive care. She lost part of her fallopian tube. So, again, issues with infertility could be happening here. Lawmakers have made small concessions to clarify two exceptions for medical emergencies, but even in those cases, doctors risk up to 99 years in prison and fines of $100,000. They can argue in court that their actions were not a crime, much like defendants can claim self defense after being charged with murder. But it's like, who wants to put themselves in that predicament, you know?
Right, right. I mean, yeah. I mean, again, you can be privately sued. The way this law is written, it is very difficult to defend yourself. It was written specifically, so it would be very difficult for somebody to defend themselves. And again, this is life changing. Um, yeah, the rest of your life in prison, massive legal fees. You're not able to make money. Your practice is over. So again, this is putting providers, I mean, it's in an impossible situation. Um,
And this is what you were saying before, that this law actually hasn't helped at all. It says, amid the deluge of evidence of the harm, including research suggesting Texas legislation actually has increased infant and maternal deaths.
right,
Some of the ban's most prominent supporters have muted their public enthusiasm for it. U.S. Senator Ted Cruz, who once championed the fall of Roe versus Wade and said pregnancy is not a life-threatening illness, and it just goes to show you like how little he knows, is now avoiding the topic amid a battle to keep his seat. And Governor Greg Abbott, who said early last year that we promised we would protect the life of every child with a heartbeat, and we did, has not made similar statements since.
yeah. And I mean, most people maybe don't realize this, and I didn't realize this until I was really in nursing school. Death by as a result of pregnancy is one of the main causes of death of women in the world. It used to be the number one cause of death for women. So let that sink in, right? Pregnancy is a high risk activity, medical event by nature for women. So it's, high risk for the fetus, the baby, high risk for women. So, but again, it was not that long ago, just a couple decades ago, if not even more recent, that this was the top cause of passing, of death worldwide, globally for women.
So this is her with her daughter that she had. So again, she was thrilled to have conceived, but trouble struck her in the second trimester. And at 17 weeks, 4 days pregnant, she went to the hospital with cramps. The next day, when the bleeding worsened, she returned. Within 2 hours of her arrival, an ultrasound confirmed bulging membranes in the vagina with the fetal head and the open cervix, dilated at 8.9 centimeters, and that she had low amniotic fluid. So the miscarriage was in progress, the radiologist wrote.
Right.
In a state that hadn't banned abortion, Barnica would have immediately been offered the options that major medical organizations, including international ones, say is a standard of evidence-based care, speeding up labor with medication or a dilation and evacuation procedure to empty the uterus. And that's what you were talking about earlier, Nurse Adrienne, about evidence-based practice, right?
Right. I mean, Evidence-based practice should be driving healthcare decisions and healthcare practice, healthcare policy. It should be the driver of what, because what else are we basing healthcare on? So let's just imagine a world where public opinion was driving healthcare.
For those that don't know, what is evidence-based practice?
So evidence-based practice means that there has been empirical research that is replicatable, showing that a certain intervention is the most appropriate for a disease process, a medical issue, that, it's what's better for a cut, right? Is it mercurochrome? Is it peroxide? Is it, double antibiotic ointment, triple antibiotic ointment? What is best for, the best procedure? How do we do, let's see, a lot of people end up having what we call cholecystitis, have their gallbladder removed. So imagine if we had no, every doctor just did it however they felt they wanted to do it, and there was no best practice involved, right? You would have a lot of infections, you'd have a lot of problems. So that's, we are led as nurses and providers, physicians, nurse practitioners, PAs, and researchers by evidence-based medicine. And
So I'm pulling this up now, and I want to highlight this because this is a lot of times what
mhm,
people don't understand, like in day to day or in the internet, right? H- Um, why does healthcare sometimes change? And it's because of evidence based practice. Because we conduct studies, and as more evidence comes out, then we change and adopt things. One example was they actually used to, with sudden infant death syndrome, they used to say, oh, like they thought sleeping, the putting the infant face down was better, and then they went to back on the back based on evidence. So the lowest form, and there's so many people on the online or even in day to day that will take expert opinion, right? They'll listen to one person, and that is what they, that is the lowest form of evidence, right? So what you and I are doing here, lowest form of evidence, right? Expert opinion.
right, expert
Right.
opinion. It is, because we are just speaking about our opinion, our experience, what we know within our scope,
And that
right?
is what is the problem with society these days, right? One person will speak out, one chiropractor, one medical doctor that has had his license revoked, and all of a sudden people want to follow all of his medical advice or buy all of his supplements or think that, whatever condition can be cured by turning around 3 times and taking this essential oil, right? And
Right.
that is the problem with science, these, or not science, but like the society in general. They go on TikTok, they're getting all of their information, or, anti-vaxxers, and then they
Mhm,
are taking that as the truth, as like the Bible truth, or, there's like a trend of like carnivore only diet or this or that. Like,
mhm.
so this is the lowest form of evidence. So don't just listen to one person. The highest form of evidence, once we start getting into actually randomized control trials, um, systematic reviews and meta-analysis. So what these top tier things here is where they have compiled several studies, and they have run analysis, statistical analysis, to show that these interventions actually do make a difference. So the highest form of evidence is systematic reviews, meta-analysis, and even you can consider randomized control trials. But stop listening to one MD on the internet that has an opposing, totally contrarian opinion. So if 99 MDs are telling you one thing and one doctor tells you, chances are the 99 are going to be correct. There's
Yeah.
just so much bogus advice out there, dietary or everything. And then people want to listen to that one expert on that one completely like out there thing.
And sometimes some of this opinion leads to bias, or it is actually formulated out of bias, and it could be about a particular group of people, right? So, and we could apply this to whether or not we say bodily autonomy. What does that really mean? What does it mean to, if we apply our opinions up towards whether somebody should have gender affirming care, whether somebody should, be allowed to have reproductive freedom, and do what they want with their body, right? As long as it doesn't affect somebody else. But also like medical interventions, on the issue of like racism in healthcare and disparities, there's a lot of this that goes into formulating false narratives about certain people, certain categories of people, about whether certain people essentially have hypertension or resistance to pain or whatever it might be, GFR. There's a lot of things that we have to become aware of as providers, as nurses. We have to be aware of our own implicit bias. Now, the general public can just weigh in and say, "Hey, we don't think you know XYZ should be happening medically anymore. So we're going to pass a law against that." Or we're going to, say health insurance can't cover this. Or it could be a company that institutes a policy of what their insurance will cover. Um, you know, People of color, I'm reading this article, face more barriers in accessing care, which includes preventative services, treatment, chronic disease management, and people of color are generally less satisfied with their interactions with healthcare providers as well. So there certainly is some, racism that comes into question here, because who's disproportionately going to be impacted by some of these laws? Now, it's not always the case, but women of color, especially Black women, have a very significantly much higher rate of mortality while pregnant. And we need to look at what we're doing here. We need to ask ourselves, do I have any business actually weighing in my opinion in something about what somebody else does? Somehow in this country, a lot of people feel they do.
Mhm. And so a physician spoke out about this case, and she said that abortion bans put doctors in an impossible position. She said forcing them to decide whether to risk malpractice or a felony charge. After her state enacted one of the strictest bans in the countries, and she was working in Tennessee at the time, she also wanted to offer interventions in cases like Barnica's until the fetal heartbeat stopped or patients showed signs of infection, praying every time that nothing would go wrong. It's why she ultimately decided to move to Colorado. So it's also look at how far reaching these laws uh, are. Essentially, it's going to become like provider desert states because the ethical providers are not going to want to risk their license, risk a felony charge by practicing in a state where essentially it's like their hands are tied because they can't do certain things. You're muted.
That. And this is during a time when Mexico has now loosened a lot of their laws, right? And they've become very inclusive of women's health. And so people are, if they have the money and the resources, they could go to another state, another country, and get reproductive care. But again, we're talking about medical emergencies. These
Yeah,
are
this was
not,
a medical
this is
emergency.
a
Yeah.
medical emergency. There's no time. These kind of infections. I mean, just imagine you've got something inside of you that is now just going to be full of infection. um, it, it, I often wonder if this also has to do with people just not understanding pregnancy, not understanding what happens to a woman's body, and how pregnancy works. I think on that basic level, just anatomy and the process, there's a high level of ignorance of this issue of how our bodies work, right? And people making really ridiculous laws about basically deciding it's okay if you don't live, right? That's what these laws say. It's okay if you don't. We're comfortable as a group of people in the state, and the state is comfortable with people not making it through a medical emergency. That's a pretty significant public policy statement to make.
And then I'm really surprised they discharged her s after her
Right.
after her enduring all of this. So, I feel like that was negligent as well. So, around 4 AM on September 5th, 40 hours after she had arrived, doctors could no longer detect any heart activity. So, soon after, Lima delivered Barnica's fetus, giving her medication to help speed up the labor. Dr. Joel Ross, who oversaw her care, discharged her after about 8 more hours. Here we go with dismissing women. And as a woman,
Right.
I've been dismissed so many times. The bleeding continued, but when Barnica called the hospital, she was told that was expected. Her aunt grew alarmed 2 days later when the bleeding grew heavier. So, again, instead of saying, "Hey, how much are you bleeding?" asking more questions. How much are you bleeding? And what amount of time? Or come back in. We can take a look at you. Are you having a fever? It's just, oh, that's normal. Oh, that's normal.
Hmm. Yeah, and I think also, I mean, yes, the context is COVID was still going on. There's still some COVID policies in process, but again, nothing about this case makes sense, and I really don't know what their policies would have been, right? Like, if you're not gonna intervene and you're not going to treat this person, uh, do you think it was because of COVID going on, kind of the tail end there, that they didn't just keep her in the hospital?
It could have been. Maybe they were overwhelmed, but also if she's complaining, "I'm having a lot of bleeding," at least have her come back in.
Yeah, and this is also where, like, having an advocate, I mean, again, people that are pregnant are typically younger, they may
I
not
don't
feel as
think she could speak
empowered.
English well because she was from Honduras and she's an immigrant, and
Right.
it was that Swiss cheese model when everything aligns, but it went negatively for her, so because
Mhm.
of COVID, she couldn't have an advocate there. So this
Right.
poor lady that doesn't speak English is in a hospital, having decisions, and the Hispanic kind of mindset, we're taught to not question authority in regards to like medical professionals. Oh, they know best. Okay, just
Right.
agree,
Right, right. It's that whole thing of just, go along. And especially, I mean, let's just say it's like this is a woman who is pregnant. She's having her own, like, you know, s- reaction. And I'm sure she's somewhat panicking about the situation and scared. And people are putting all of their trust in our hands. They are trusting the medical system, the healthcare system to take care of them. There is an implicit trust, no matter, I mean, because what is the other option, right? I mean, people think they're going to the doctor, they're going to the emergency room, they're going to be treated. And whatever the doctor says is going to be, or the PA, the MP is going to be, okay, this is the right thing to do. But then even if she didn't feel like it was the right thing to do, did she have any ability to advocate for herself? Probably not.
No, I don't think so. So this is what you and I were talking about before. It says in 2023. So imagine they only made this concession. Again, here's their like
Right.
their lack of knowledge and complete ignorance that they passed a law first, and then because people were outcrying, then they made a concession that it created an exception for ectopic pregnancies, which is a potentially fatal condition. I'll show a picture here shortly. Um, and for cases where a patient's membranes rupture premature before viability, which introduces a high risk of infection. Doctors can still face prosecution, but are allowed to make a case to a judge or jury that their actions were protected. That's almost like instead of innocent until proven guilty, this is almost guilty until proven innocent.
Right. And who's going to do that? Who's going to go to court? And I mean, it's just because somebody there is watching and waiting to snitch on that provider in the healthcare system. I mean, they're going to find out. Yeah. I mean, again, if I have to go to court over every decision I make and defend what I do, yeah, this is not practicing medicine at all. This is, you're you're not free to do what you know is the best thing to do. You're under the stress of, oh, I'm going to be sued. I've got to end up in court. I'm going to have a humongous legal bill, right? Legal obligation. Again, back to like just racism in healthcare, right? I mean, there's so much mistrust. There's a lot of mistrust as well as trust, right? There's people are hoping that they're going to be treated correctly, they're going to be treated appropriately. Yet the experience people have, especially people of color, is very different. Um, Hispanic, Latina patients, I'm reading this other study, and the National Institutes of Health were viewed as unlikely to accept responsibility for their own care and more likely to be non-compliant with treatment recommendations. So this is the perception of healthcare providers, right? This is white healthcare providers specifically in this research. Um, and also implicit bias about Black American patients, viewing them as less intelligent, less able to adhere to treatment regimens, and more likely to engage in risky behaviors than their white counterparts. So again, then you add in being pregnant. You add in the vulnerability of being pregnant into this. And I know we talked about kind of continuing this topic about maternal health and going a little deeper into Black maternal health issues as well, and talking a little more deeply about that, because it's a significant healthcare crisis in our country right now. And I mean, I don't know. And this the hard part is there's no solution. There isn't. There's not like, hey, here's a plan to rectify this, right? When we've institutionalized and made policies now that put people at this high risk.
So there's no easy solution, but what we can do here, I mean, the election is what, the 5th? Is that when voting is?
Tuesday, yeah,
Um,
early voting. I mean,
what
I
we
voted.
can do in the meantime is vote for lawmakers that are not putting these laws in place and are not
Right,
for these laws.
right. I mean, it's again like these. We call these like, let's think 100 years ago, right? At what point did politicians decide, hey, I'm going to start getting involved in healthcare policy making versus how to fix roads and run police forces and public agencies and again, there is public health, of course, but public health has largely been privatized in most around the country. But
It's so dangerous. Remember I sent you a text about how like Trump's administration had banned the EPA from reporting on certain toxic chemicals.
yeah,
That's something I need to do a video on as well. So it's like why, like you're saying, why are they making it's the Environmental Protection Agency? Like they're
right.
supposed to protect us.
Right, right. Yeah, well, I mean, that's the whole thing, Project 2025, right? Is just eliminate basically everything, all regulations, all protections. We'll just, watch as, animals go extinct, water becomes, even more polluted, land becomes polluted. Again, there's some good reasons that these laws are in place because there are been, just on a totally different topic, if people want to just Google like Dow Chemical in Michigan and see what happened there, right? When we trust companies and we allow them to operate without rules
Any
or
regulation.
bad things happen and people's communities are poisoned forever. There's no turning back. There's no unwinding it. But yeah, and I mean, this is, wasn't meant, this is such a broad topic. So we didn't mean to by any means uh, have a totality of conversation about this because it is a very nuanced topic. It's very specific state by state. We've got nationwide laws. We have an election and, in 48 hours, we're going to know pretty much results of, or at least which way it's heading. And it's hard to know which direction this country will take. I mean, unless you're in a state that has really advanced protections, but even then, there's federal law that oversees that is a payer. The federal government is a payer of healthcare. It's also a provider of healthcare. So there's still a lot of control that the federal government can exert over healthcare and over our lives, which is ironic that a lot of these people are kind of like the homesteader people too, right? These are the people that are like less government. Well, why are they voting so much for government intervention? This is not a libertarian value according to the people
Yeah,
I know.
it's definitely contradictory. It's like less
Right.
government for what they want.
For what they want, right. We want to just be able to do whatever we want,
Yeah.
educate our kids wherever and however we want, but we want to have total control over other people.
Mhm.
Yeah, and this is a really important issue. So it's if when you're watching this video, everybody, you guys make sure you subscribe to both of our channels. Make sure you comment. Let us know what you think, what topics you'd like us to cover. We're going to continue this issue. We're trying to work out our schedule. Sorry, we don't have a regularity yet. We're a little, both of us are
Also
in.
drop a comment, what schedule would you like? What day of the week works best?
Yeah, let us know, because that we're thinking about doing some off live collab videos too, so we could just drop them at certain times and bring more people in. If you know people who might be uh, great guests on our for us, also let us know. I did want to give a pitch to the organization that is near and dear to my heart, the Black Coalition for Safe Motherhood. Go look that up, you guys. Follow. I think they're on LinkedIn. Sign up for their mailing list. Donate to them. Be educated. They do a free training on empowering Black women, Black moms, and communities and providers. And so that's a amazing, amazing organization, Black Coalition for Safe Motherhood. That's my little pitch for today. That's it.
Awesome. Thank you everyone that tuned in. Like Adrian said, make sure you like, subscribe, and share and get out there and vote.
Yeah. Thanks so much, you guys.